All right. Good evening. Thank you for braving the rain for us, coming out to be with us this evening. Um, Good evening and welcome to Art and Practice. My name is Alexandra McShaw. I have the pleasure of serving as the Manager of Education and Public Programs at the California African American Museum, where we are the museum of residents here at Art and Practice. Thank you so much for being with us for tonight's community dialogue on maternal and infant health and Black women for wellness. A care forward conversation with Eboné McCloud, who's our program manager here at Art and Practice, and Gabrielle Brown, maternal and infant health program manager of Black Women for Wellness. This conversation explores the impact and racial disparities and structural racism and the ways that they impact the current state of Black maternal and infant health here in California, while highlighting the need to organize, mobilize, and advocate for meaningful change using resources within the organization's Black Joy Guide. Gabrielle Brown serves as the program manager for the Black Maternal and Infant Health Program at Black Women for Wellness, where she leads with passion, purpose, and an unyielding commitment to reproductive justice. A dedicated advocate and emerging policy leader, Gabrielle drives forward transformative change in Black maternal and infant health by holding healthcare systems accountable for addressing racism, discrimination, and implicit biases. Meron Shita could not be with us this evening, and we are sending our best in her absence. And before I start, I want to just thank the incredible staff here at Art and Practice for working with us. And without further ado, I'd like to open it up to the conversation. Thank you so much.
Thank you so much, Alexandra, and thank you all so much for being here. Hello, hello. Hi. All right, so before we get started with the conversation, we're going to do a grounding practice. It's going to really root us in the space. Does that feel all right? All right. Thank you. All right, so I invite everybody to sit up nice and tall, planting your feet shoulder width apart, closing your eyes and focusing on your third eye point, which is situated right between your brow. Placing your palms on your knees, either face down to ground or faced up to receive, or one or both, whatever feels the most comfortable. Really being here in the space right now, allowing yourself to just take a load off. You braved the weather, and you are here in this space. Feeling your body at ease, breathing at your normal pace here. On your inhale, I invite you to fill your belly with air, and on your exhale, pulling your shoulders away from your ears. Deep inhale in. Slow exhale, pull those shoulders away from your ears. I invite you to imagine that this space is just truly for you. No one else is here. It is just you. So take up the space with your breath. Inhale deep. Exhale. Really feeling your body and asking, what does it need from you in this moment? Inhale deep. Hold it. 2, 3, 4. Exhale. Two more times. Inhale deep. Hold it. 2, 3, 4. Exhale. Last time, make it big, make it count, make it worth it. Inhale deep. Take another sip. Loud exhale. One more time for good measure. Inhale deep. Hold it. Take another sip. Loud exhale. Allowing your shoulders to still pull away from your ears. Grounding your body with your feet shoulder width apart. Really sitting in this energy. The energy that you're creating. And for others around you. Last collective inhale. Slow exhale. Whenever you're ready, you can return back to the space. How'd that feel? Good. Good. All right. So let's go ahead and get started.
Let's
excited.
do it. Thank you so much for grounding us
Yeah.
because it's been a hectic day with this rain. You know, us LA folks, we get a little flustered in the rain. So thank you.
Y'all do, but But I'm so grateful that everybody is here and everybody participated in that breath. It really helps to ground us as individuals and collective. So I'm excited to get the conversation started. Yes? We're feeling good? All right, look, I'm going to need a little bit more energy. Y'all feeling all right? Thank
Woo!
you. Okay. So let's go ahead and talk about some maternal and infant health, shall we? So just to provide some broad context for our audience, Gabrielle, let's start the discussion on Black maternal health and exploring the realities of Black mothers and babies in California and how history, systems, and policy shape these outcomes. Yeah?
Yeah, and that's a big question, right? So I think I'll start with the current state of Black maternal and infant health. I mean, data shows that Black women are 3 to 4 times more likely to die from pregnancy-related complications. Black infants are 1 to 2 times more likely to be born at a low birth weight or to die during infancy compared to white infants. And I really want to emphasize that these disparities are shown across education and income levels. So if you all are familiar with the stories of Serena Williams, Olympian Allison Felix, right? They have been very public about the experiences that they've had when seeking maternal health care, how they felt that they were not listened to, and ultimately we know that that is a root cause, right? Understanding that unfortunately implicit bias, racism, and discrimination is embedded, unfortunately, within our healthcare system, and that is seen through, women going to seek care and not being listened to, or being sort of labeled as having a higher pain tolerance, right? And so I think ultimately there's this sort of compounding effect on top of just trying to make it in life, right? And so I think collectively, all of these issues, unfortunately, contribute to the disparities that we are seeing in the data. Now, I do have to share that there have been some improvements within the state of California in terms of improving birthing outcomes, but unfortunately, there is still a lot of work to be done.
There's so much to extract from that, so thank you for sharing that because I think that it's really helpful to hear about numbers and statistics. Bless you. The statistics about what's happening in this community specifically, right? But if we can just going to the historical and systemic factors that contribute to the racial disparities. I know that you briefly touched on that, but if we can talk a little bit more about that so that we can just get some groundwork on, or foundational understanding around that.
Yeah, and so when we think about the mistrust that we have with our healthcare system currently, we really have to ground ourselves in the historical context around chattel slavery in America and the experimentation of black female slaves and black bodies. And I want to uplift Anarcha, Lucy, and Betsy, whose bodies were experimented on. They were black female slaves in Alabama, Montgomery, Alabama, and their bodies were experimented on as a way to identify a surgical procedure to repair a vaginal fistula. And so this experimentation was being led and done by a white man. His name is J. Marion Sims, and he is notorious for being the father of gynecology. And so it's important to say the names of these female slaves, Anarcha, Lucy, and Betsy, because in this maternal and infant health space, we know them as the mothers of gynecology, right? We're instilling that power into these women whose essentially their bodies were used to be the foundation of modern obstetrics and gynecology, right? J. Marion Sims has profited, in his lineage, has profited from the experimentation of their bodies and is profiting from being known as someone who advanced medicine at that time, but we also have to recognize that dark history. Also, in terms of historical context, it's important that we recognize the displacement and erasure of granny midwives in the early 20th century. So granny midwives were they served as birth workers. They essentially birthed this country, right? They supported slaves, right? But they also supported everyone else in the community as well. And so it's important for us to look at that displacement and that erasure from a lens, from a lens that is rooted. It is inherently rooted in racism. We saw racist medical licensing laws that came from the erasure of granny midwives, public health campaigns that labeled these granny midwives as untrained or unsafe despite their deep expertise and trusted role within these communities. And so with this erasure, we sort of saw this over medicalization of our healthcare system where instead of going to a granny midwife who had probably been catching babies her entire life, we are now entrusting our life and our bodies in someone who has a white coat, right? Who went through this sort of training and educational process, but may not have all of the wisdom that a granny midwife may have. And so when we think about some of the historical context and the mistrust, unfortunately, that is rooted in the oppression that we have seen within maternal and infant health and within our communities. And unfortunately, that is, being shown today through the implicit bias and the discrimination and the racism that we are seeing in healthcare today. There's a data point that I like to share. In 2016, 11% of California Black women reported that they were treated unfairly during a hospital stay for childbirth because of their race and ethnicity. And so now this data point is 10 years old, but I'm curious if anyone has recently seen on social media, on the internet, of women coming out and sharing their stories about discrimination that they have experienced when seeking healthcare. If I can get a raise of hands, if anyone has, okay. And so I see some head nods. Thank you so much. And so it's unfortunate that when we recognize the historical context, we see the sort of trickling and the trickling down effects and the legacy of that today. I know that was a lot.
No, it really does. As you were speaking, when you, yeah, that one's dead. When you were speaking, I was thinking about this example that I've seen on social media of the woman who was at the nurse's station and was in active labor, and no one was helping her, and so this just is a continuation of this narrative from what you were saying from the three women, right? And it's quite unfortunate to have to still be living in that time where we are seeing this happening all because of race. And you said 11% was 10 years ago. So we can't even imagine what that looks like now, right? To skip around just a little bit while we're still on that topic of like granny midwives and things like that, do you have any examples of how patient advocacy by family, doulas, or community health workers can certainly make a difference?
Yeah, so I think we always encourage expecting folks to look into getting a doula, look into giving birth at a birthing center, or really just look into the options that work best for them, and really build out a birthing plan. But we know doulas are non-clinical support persons that can really go, with that expecting person to check checkups and visits, ask the right questions, because really it can be intimidating going into a doctor's office and sort of being one out of I don't know how many patients. Hi, everyone. Welcome. It can be intimidating to walk into a doctor's office and you're one of, I don't know, 50 patients that day, and you're sort of rushed through the process. You may have wanted to ask some questions, but maybe, you weren't able to get to it. And so, really utilizing birth workers like doulas really doulas throughout the perinatal journey is critical to ensure that you can have the healthiest and dignified and most dignified perinatal journey possible. But in terms of like patient advocacy, I think also about storytelling and being in spaces similar to this, sharing those experiences, but also, going into a bit of the policy and stories that can be utilized to sort of inform and support policy as it's moving through the legislature. I think that that is so amazing. I have an example of a piece of legislation that was moving through the legislature in 2024, and we were able to engage around 2,000 community members in terms of storytelling, right? Advocating, sharing their stories. And I think as we sort of come together collectively and share our experiences when seeking maternal health care, I think that it's undeniable that there needs to be improvement, but also that helps to inform the development of policy as well. No.
Oh, okay. So speaking of the California policies that have helped improve the outcomes, obviously we still have a long way to go, but what are some things that are getting us on our way to
Yeah, and so I would like to highlight obviously Black Women for Wellness. We're a nonprofit reproductive justice organization located around the corner across from the Pizza Hut. Um, but also, so we're a 501(c)(3), but we also have a 501(c)(4) organization, Black Women for Wellness Action Project, which really has been pivotal in having legislation passed that seeks to improve birthing outcomes throughout the state of California. Senate Bill 65, the California Momnibus Act, it allows for anyone who qualifies for Medi-Cal also qualifies for a free full spectrum doula. And so I think that, at Black Women for Wellness, we do the work to get the word out there. But unfortunately, a lot of people don't know about this benefit, right? And so I think that um, cost can sometimes be a barrier. And so this piece of legislation eliminates that and allows for a birthing person, if they want to have that advocate, and they want to have that support person with them throughout their birthing journey, they can now do so for free. Also, Senate Bill 464, the California Dignity and Pregnancy and Childbirth Act, it requires that providers in the state of California that treat and serve pregnant patients, they are required to take an implicit bias training every 2 years. Now, what I want to share is that this piece of legislation was passed, I want to say, the beginning of 2020. Now, as we know, the beginning of 2020 is when it all went down and COVID hit. And so, obviously, our healthcare system was deeply impacted. But nonetheless, this is a bill that is in law, and there is this requirement for providers to take an implicit bias training. And so, I was able to develop a relationship with our state attorney general, Rob Bonta. The Department of Justice performed an investigation into implicit bias training compliance throughout the state and ultimately found that around 80% of providers throughout the state of California were not compliant with taking their implicit bias training. And so this says a few things. It says maybe folks don't know that this is a requirement, which then we have to put accountability on the hospital and the healthcare system within itself. But also, if folks do know about about this required implicit bias training, they aren't taking it serious and not understanding that this is a requirement, and it is meant to improve the quality of care that we are seeing within our healthcare system. I just want to recognize that I see your hand. Okay. That is a great question. So, what I will say, in me developing a relationship with our Attorney General and the Department of Justice performing this investigation, we find out that folks are not compliant. We then developed some policy recommendations, and that birthed Assembly Bill 2319, which seeks to hold providers accountable through enforcement, regulation, and fines. And so that was passed in 2024. Yeah, we try our best. We yeah, right. And so what I'll say is that through AB 2319, as I mentioned, it's meant to have that regulation and that enforcement. And so now hospitals themselves are required to monitor compliance of implicit bias training and sort of submit a report to the Department of Justice and the Attorney General. And that is sort of the mechanism that is being used to hold folks accountable. And I want to say that in the piece of legislation, there is this requirement that I want to say by like June of this year, that all facilities are required to submit that compliance report, and it will be sort of published by the Attorney General. So it will be public knowledge where folks are able to go, into a website and see if, local facilities in their area, they'll be able to have a glimpse into those compliance rates. So what I'll say is tricky, because our healthcare system is massive, and folks like to run away from accountability. And more times than not, you unless you know somebody who knows somebody, you aren't gonna get directly to the person who is in leadership, in admin, that is supposed to be, overseeing X, Y, and Z. And so I think it's really important for us to sort of work on relationship building. I know that it can be difficult engaging with hospitals, engaging with the healthcare system, especially as birth workers. And so I think ultimately the goal is to continue to build out those relationships, to have that transparency, but also accountability. Thank you for your question.
So as we're talking about that, just wanting to identify other gaps that are being missed, or in access provider availability, culturally responsive care, or postpartum support, in addition to everything else that we just shared.
Yeah, and so what I'll say is ultimately we are seeing a lack of access to healthcare. There is currently a trend of maternity ward closures really across the nation, but it's something that we are seeing in California and specifically in LA County. I like to share, unfortunately, Centinela Hospital in Inglewood, they closed their maternity ward a few years ago after a Black woman, April Valentine, lost her life during childbirth there. And that, the loss of her life prompted an investigation They were found to be negligent, I believe fined like $75,000. And instead of paying the fine, working to invest in their infrastructure, invest in their providers and the quality of care that they provide, they decided to close the doors to their maternity ward. And if you think about it, I mean, Inglewood is densely populated, right? We got all the new stadiums, block after block after block. It was just what NBA All-Star Weekend, right? But folks who live in the community don't have immediate access. Um, Food deserts are a thing, right? So as I mentioned earlier, we're seeing this compounding of issues that are disproportionately impacting Black women and Black families. And so on top of the maternity ward closures, I think in general we're seeing a lack of culturally relevant providers that look like you, that come from where you come from, that understand what it means to navigate a world full of food deserts, right? And so I think that that is where we see the disconnect in the quality of care that is being provided. And also wanting to share, there was a piece of legislation that went through the legislature last year, Assembly Bill 55, which seeked to remove some of the barriers around birthing centers getting their licensure through the state of California. And so what I'll say is, we're seeing this trend of maternity ward closures. So hospitals are closing their labor and delivery wards. Folks are having to go far distances to seek care. And in LA, that can take an hour plus, right? And so this piece of legislation really seeked to ensure that birthing centers that are seeking to serve communities that have the highest rates of disparities, ensuring that they sort of have an easier pipeline to get that certification. And proud to say that AB 55 passed into law last year, right? And so I think that that is another effort that is, working to improve birthing outcomes, like little by little, by engaging birth workers in the community and birthing centers to ensure that they can be licensed within the state, but also ensuring that midwives who are leading the birth centers can be adequately reimbursed through Medi-Cal. Mhm. We have another question. Thank you, Miss Yolanda. Yeah, that is a good question, and it's hard to say because in engaging in a variety of coalitions, many times we engage with folks who live in the South and have a lot more restrictive policies, and I think we live in a state where we are able to educate and inform our policymakers to get laws passed to ensure that there are requirements around the implicit bias training, to ensure that there is a Medi-Cal doula benefit so that folks in the community can have a doula for free. And so what I don't know that we can, maybe we can attribute to improved outcomes to clinicians, but I also think that It is a combined effort between, I think, policy, community advocates and activists, community based organizations that are really holding it down, like Black Women for Wellness, who are out in the community surveying what exactly the community needs to support them around their journey, and connecting them, referring them, establishing those warm handoffs so that folks can, get the services and the resources that they need. And so ultimately, I think that it is a combined effort. And so, like I said, I know that we are doing a bit better, but we still have a lot to do. Thank you.
Thank you for your question. Are there any other organizations that you all for Black Women Wellness work with?
Yeah. There's tons of amazing organizations across LA that seek to improve birthing outcomes. I love to highlight AIM, the African American Infant and Maternal Mortality Prevention Initiative. Is such a long name. An initiative through LA County Department of Public Health, and they are just out in the streets hosting community baby showers. They have community action teams across all of the service planning areas throughout LA County, engaging with community members. They have like a fatherhood engagement group, engaging new Black fathers through a mentorship style program. So yeah, they do amazing work. California Black Women's Health Project. They have been pivotal in the Black maternal health movement. I love Uplifting Cinemoms. They're down the street on Crenshaw and Obama. They're an affiliate of WIC. They serve Black moms who go through the WIC program. Would like to shout out, we are collaborating on an event with them next month, hosting a live cooking demonstration, to educate and empower folks in navigating food deserts. And so, yeah, there's tons of organizations, and would be happy to share a list with you all. Oh, yeah. Yep. LA County Medi-Cal Doula Hub. Front, Frontline Doulas. Charles University Black Maternal Health Center of Excellence. Yes, no, we got some folks. We got some folks in the Black maternal and infant health movement. Yeah, that are working collectively. The California Coalition for Black Birth Justice. They hosted an amazing Black Birth Equity Summit in Sacramento in October. It was really like a family reunion. um, and so yeah, there's tons of amazing folks that are on the ground doing the work, and I just have to share, like, the work is difficult, it's heavy, especially in this political climate with this administration, with the repealing of funds, of historical education, right? I think, well, we know that all of this is intentional, and I think, unfortunately, it makes the work really, really hard, but we out here making it happen.
And thank you.
Yeah.
Thank you so much because that is yes, you can because like you said, it is so hard, right? And I certainly commend everybody who is a part of this work, this reproductive justice. Like, we don't talk about it enough, and I see everybody, and I thank you. Yeah. So to not move away from this, but for the sake of time, we do need to go to the next segment. I'm gonna pass it off to you since Meron is not here, and then we'll just get started in those questions. Does that feel okay?
Okay, so as was mentioned, my colleague Meron Shita, she was not able to make it today, but she is our civic engagement manager at Black Women for Wellness. And so I would like to share a bit about how might federal legislation such as HR 1 influence funding, accountability, and access to maternal and infant health programs serving Black families in California. And so, who has heard of HR 1 or the Big Beautiful Bill? Okay, yeah. um, OBA, Okay, Oba, yeah. Okay, thank you. Yeah. Not so beautiful, but okay, right. And so on July 4th of last year, Trump signed H.R. 1, or OBA, into law, which stands to have devastating effects on our communities, from healthcare access, our community's economic security, to immigration, which we are seeing across the U.S. And so, I really want to highlight that HR 1 cuts more than 1 trillion from Medicaid and the Affordable Care Act marketplaces. Nationwide, Medicaid covers over 64% of births. In California, Medi-Cal covers close to 50% of births. And so when we think about the repealing and the cutting of Medi-Cal, that's 50% of people who are going to have to figure out how are they going to give birth at a facility, and what are they going to do, right? Like, I really just think about this all the time. What are folks expected to do? Give birth in their cars or, like, at home unassisted? And so also, as I mentioned, up to 3.4 million Californians stand to lose their Medi-Cal coverage, and the state could lose about 30 billion in federal funding a year. This ultimately will destabilize the healthcare system and drive up healthcare costs for everyone. Also, we are seeing cuts up to 20% of the budget for SNAP, the Supplemental Nutrition Assistance Program. So SNAP helps over 5 million Californians each month under the CalFresh program. CalFresh kept 1.1 million people out of poverty in California, and the cuts will either eliminate or reduce monthly benefits of 97% of households who receive CalFresh. These are huge numbers, y'all. Like, and so when thinking about cutting access to healthcare, cutting access to food, right? It really puts folks in a space where, unfortunately, we will see an increase in the disparities and in the numbers that we are already seeing. Also, in terms of like how this will impact hospitals and providers, we will see, or we anticipate, expected reimbursement cuts for hospitals. And, I spoke earlier about this trend of maternity ward closures, and we can very well see sort of an expansion and continuation of the elimination of maternity services, which is further contributing to this growing trend of maternity care deserts. We anticipate a shortage of OBs, so OBGYNs. Due to this, we will see an increase in travel times that it will take to get to different facilities. And ultimately, we will see an increase in emergency deliveries and emergency calls, which will then have, again, a financial impact on community members. And so next, I want to jump into, thinking about preliminary and midterm elections this year and the impact that that will have, and thinking about what changes can we consider that could possibly help, or what are some of the harms that could contribute to even worse disparities and outcomes for Black families in our communities. So obviously, I mean, we're already seeing the rollback of equity-centered public health initiatives, and this weakens progress towards reducing the disparities that we're seeing in maternal health outcomes, chronic disease, and life expectancy. Medicaid cuts obviously are expected to deepen these health inequities for Black communities. Black families account for roughly 20% of Medicaid enrollees and face a significantly higher likelihood of losing coverage compared to white families. Um, and then, in terms of what could sort of help as we're coming up and considering these elections, I think really looking into protecting and expanding coverage. So, working to maintain state funded maternal health services, thinking about extending the 12-month postpartum Medicaid coverage, extending family planning access, and supporting reproductive health providers. We're seeing recently, I think last week, that there are a bunch of clinics that are closing across LA County that support community members in providing reproductive and sexual health services. And so now folks have to figure out where else are they going to go to seek care. And unfortunately, we can potentially see an expansion of those disparities. We can also consider like stabilizing care infrastructure, so investing in safety net and rural hospitals, and sustaining perinatal care coordination programs. So really working on providing wraparound services, investing again in those community-based organizations, and so I think that those are some options that we can consider in terms of ahead of the election and listening to different candidates and what they say on their campaigns. But right now, it's just kind of difficult to um, see a world outside of the current state. It's just a very heavy state that we're in currently. Um, And so, lastly, I guess just in terms of how community members can stay informed, involved, and empowered to advocate for healthier outcomes for Black mothers and babies, you can track the budget process. So, watch for Senate amendments, conference committee negotiations, Medicaid specific provisions. And just want to highlight this is not my wheelhouse. This our civic engagement manager gave me these notes, so I'm sorry if I can't expand and elaborate. But you can also so state impacts often appear in fiscal notes and budget analysis. So when looking at these state amendments, conference committee negotiations, and Medicaid specific provisions, you can look at notes and budget analysis, but also engage at the state level. So even when federal policy changes, California decides how to implement cuts or changes. State legislators influence Medi-Cal design. The governor's budget proposals determine program survival. So I think although we are seeing this trend of policy at the federal level, I think we can do what we can as folks living in California to engage with our policymakers and our legislators at the state level, expressing our concerns, our wants, as a way to influence policy that is beneficial for our state outside of federal policy. Yep. Thank you.
And if you have any questions or want to discuss more about that, we'll go into question and answer in just a little bit. But for this last segment, before we go to Q&A, I want to talk about, I mean, everything. We're feeling everything, and so I want to be very respectful and mindful of that. But I also want to talk about some joy. Okay. So when we first met during the opening of Giving You the Best That I Got, which if you have not seen the exhibition, please make your way. It is across the street at Art and Practice. It's on the corner. We're open from Tuesday through Saturday from 11 a.m. to 5 p.m. And it's a really beautiful exhibition just highlighting all types of layers of mothering, motherhood, and the full spectrum of that. And so we would love to have you and come stop by and see what the exhibition is all about. And so during the opening of that, that's where we met. And you had an information booth, and I was introduced to the Black Joy Guide, which I think is just really beautiful. If you were unfamiliar, we'll talk a little bit, well, Gabrielle will talk a little bit more about what the Black Joy Guide, but it is a tool to support mothers and guide them on their pregnancy and birthing journeys. And it can also be used as a resource to mitigate the lack of access to information, as we've been talking about, and resources that impact Black maternal health. So, in your view, what are the most actionable steps I can read, I promise. What are the most actionable steps health systems can take in the next 3 to 5 years to reduce Black maternal mortality and morbidity?
That's a great question. Thank you. And so I think I do want to start by sharing the Black Joy Guide, sharing a bit about it. We do have a flyer here with a QR code that you can access digitally. Thank you. Um, and it is a comprehensive book and guide that is meant to support expecting families, those who are considering starting a family, or those who maybe have multiple little ones and are maybe just wanting a culturally affirming resource that highlights the different community based organizations and institutions across LA that are meant to serve them. And so I highly encourage you, if you are not familiar, to scan the QR code. The flyer is getting passed around. Also wanting to highlight that we do plan to publish a new edition of the Black Joy Guide during Black Maternal Health Week this year. And so we will talk a bit about that in a bit. And so in terms of what health systems, actionable steps that health systems can take, I think ultimately there needs to be a cultural shift in terms of the type of and quality of care that providers give to folks, specifically Black folks. And I think that healthcare systems need to recognize the disparities in the data and do what they can to ensure that their providers are providing the best quality care possible, but also investing in this gap that we are seeing between hospital and healthcare providers and birth workers that are out in the community. There are many times when I have heard about a doula going in to, serve their patient at a clinical visit, and they have been turned away or questioned about why they're there, ignored, right? And I think that unfortunately, birth workers are not seen as a valued healthcare provider. And so I think that goes into that cultural shift and the shift in the cultural narrative that needs to happen. And I think ultimately there just needs to be an investment to ensure that we build, we to ensure that we recognize that there is a mistrust between our communities and the healthcare system. And so if there is a level of accountability, what are healthcare systems going to do to build that trust? What public programs are going to be available for birth workers to come in and engage with healthcare providers, right? Or for local community members to come in and engage with healthcare administration, get to know the facility that they are going to seek care at. I think that there are holistic practices and models that can be followed. And I think with the implementation of that, we can see an improvement in birthing outcomes. but folks have to want to do the work first. And so I think that is the barrier. But I have faith that with policy at the state and at the local level, I think with all of the community-based organizations that we named earlier, community advocates and activists that are on the front lines, engaging and building relationships with healthcare providers, I think collectively we can see that increase in birthing outcomes. Thank you.
And also, before we get to Skyland, I just oftentimes sometimes we just don't know the right question. What should we look out for? We don't know, then we're not gonna ask.
Yeah, and I think that's why the Black Joy Guide, to go back to that, is such a beautiful document because it includes questions that you can ask your provider. Because we understand, like I said earlier, it can be a bit intimidating when going into a medical office or going into a checkup visit, a clinical visit, and you're sort of rushed through the process. And so the intentionality of creating this guide is to ensure that folks are empowered. They have this tool. They can go in to a hospital. They can go into a clinic with this guide, with questions that they can refer to ensure that all the questions that they have are answered. Yeah. Thank you. And so I would love to bring up my program coordinator, Skylin Hayes. So Skylin, if you could please introduce yourself and talk a bit about Black Maternal Health Week this year.
Yes, I can. Can you hand me that flyer if you don't mind? Thank you. Can you all hear me? Are we hanging in there? We still here? We still present? Okay, now we're on to my favorite part, right? We got advocacy, policy, and then we have action. So not only are we doing the advocacy and the policy, we're also doing the boots on the ground work, which is my favorite part. So without further ado, we are going to get into BMH Week, which is Black Maternal Health Week. It is hosted every year from April 11th to April 17th. We do have a lot of things planned. Might I add, very intentional work. And one thing I can say I'm very excited about for this year is that the theme is rooted in justice and joy. They do go hand in hand. They do. A lot of the times we do a lot of the boots on the ground work and it's rooted in justice. But where's the joy? Right? How do we uplift our mamas in modern day times? What does that look like? Does that look like relieving any financial burden? Does that look like holding space? Just listening to a mama about her pregnancy journey, what support she may need if she doesn't have a partner, if she does, where if she doesn't have a doula, how can she get one? If she doesn't have a midwife, how can she get one? What does postpartum care look like? I run into so many mamas who come to us on a daily at any program and be like, I'm 3 months postpartum and I don't know what's going on. I'm feeling stuff here. I'm crying. My hair falling out. It's, there's nobody to talk to. And then, you don't necessarily have medical services that do provide that support for postpartum care. We have mommies who have babies in the NICU with no support or no resources. We have mommies who are experiencing loss when they lose their babies due to SIDS or any other, infant underdevelopment syndromes. So in the midst of us doing this work, we're also getting moms that are coming up to us in the middle of programming, asking for these resources. And like Gabrielle said, that's where those partnerships come in handy. Like we try to make sure at every program we have doulas and midwives that are present. We have postpartum doulas, we have pregnancy doulas, we have prenatal doulas, and just educating our moms about all the resources that they can have, regardless of financial stability, regardless of displacement. Some of our moms experience houselessness, so making sure that if we can't provide that direct resource, that we have other people that are right in line to provide those resources. So without further ado, I want to share the programming we have. So our first event will be Dear Mama, which is essentially something Gabrielle and I created to basically be an activation event for Black Maternal Health Week this year, and it's essentially for us to hold space for mothers who are experiencing different levels and areas of motherhood. Like I said, mothers that are experiencing postpartum, mothers who have grown children and just want to advocate and educate and share some wisdom, mothers who are expecting, mothers who are experiencing other type of health issues after expecting. I know we run into a lot of moms who may have lupus after having their child, and how to navigate that. Moms who have HIV after having their children as well. So all these different intersectionalities of being a Black mom and actually addressing the social determinants of health of Black motherhood. So that's essentially what Dear Mama is, holding that space and grounding our Black mothers within the space, writing letters to themselves, to their grandma, their aunt, their sister, and really understanding what it means to celebrate Black Maternal Health Week. It's not just about educating ourselves and doing the hard work and, constantly advocating for ourselves in the community, but being joyous. And what does joy for a Black mom look like? Like, just on a day-to-day, doing something nice for yourself, just for being a mom, just for waking up and being a mom, no matter what stage you're in. So that will take place on April 13th from 6 to 8 p.m. And I will pass around this flyer. We do have some downstairs as well where you can scan the QR code to stay up to date for location, time, if anything changes. We would love for all of you to be present. And then our second event is our Black Moms Birthing Tour. I'm going to get into the meat and potatoes of our birthing tour. Our birthing tour is one of my favorite areas of programming. A lot of the things that Gabrielle just discussed about what questions to ask, being in that space and what it looks like, actually being transparent with these healthcare providers in hospital medical spaces. We also do tour birthing centers too. I don't know if you all are familiar with Kindred Space. I know our last birthing tour we did also tour Mind Body Birth LA. So some birthing centers outside of just hospitals and labor delivery units at hospitals. So our mamas know that they have different options. If you don't want to have your birthing experience at our hospital, you don't. You can also have your birthing experience at a birthing center. And that's another thing, right? Let's say one of our mamas choose a birthing center, but they don't have any medical insurance to cover the birthing center. So now we're running into issues, well, I don't want to have my baby in a hospital, so how do I find funding? And that's another thing we're running into. So that's another public policy issue, right? And constantly as we host these birthing tours, we find different things that we need to navigate. And what I think is so powerful about the birthing tours, when we get in these spaces and we have mamas that are expecting at any point of their pregnancy, we also have doulas and midwives present and their partners. They're all welcome on the tour. And we're asking the hard questions. When we request a tour, we also ask that the director of the NICU be present, the director of labor and delivery be present, the director of hospital admin be present. Who do they talk to about health insurance? What does that look like when it comes to their birthing plan? Will their birthing plan be honored? Will their doulas be honored? Will their midwives be honored? How often are they in communication? How do you hold someone accountable regarding hospital administration, hospital policy, right? Because you can tell us something isn't law, but it's hospital policy. How do we differentiate the two? How do I know that I'm coming in here for this tour and you're saying all the right things and I come to give birth to my baby and it's night and day? So when we are in these rooms during the Black Mama's Birthday Tour, we're asking these questions. Eugenics is generational trauma. There's no way of getting around that. So how do you explain to a clinician if a Black mother says she's in pain and you're a non-Black clinician and you're saying, oh, you're just having contractions, how would you know to approach me? How would you know to come to me if in my time of pain? I'm experiencing bodily pain, and you're a non-Black physician. How do you mitigate that cultural competent care? And then we also ask them the questions of, have you completed the implicit bias training? And then once you're in there, it's like sometimes it's crickets, sometimes it's like, yes, we have. You can ask at any time. They can show you, and then we have some like implicit bias training, and then you have moms and doulas in a room like, you see, they're not doing what they need to do. And you can see the work happening in real time, because also when you pass the message to doulas and midwives, they can let their other expecting mothers know, I just went on a birthing tour last year. We do this twice, mind you. We do this 2 times a year. And they can let other mothers know, like, I just went to a birthing tour. They are not they're not providing the care that you want, so constantly having to be those boots on the ground until we get something that's a little bit more efficient. This is how we hold them accountable. This work is curated so intentionally Like, I want our mothers to be able to say, oh, I visited Cedar Sinai. This is the director of the labor delivery unit. This is how you contact them. Should I have any insurance issues? This is who I talk to an admin. These are the things they're supposed to be able to have. If their doula needs to talk to somebody, if the birth plan changes, this is the person that they talk to. The nurses are who you deal with on majority of the time while you're laboring. Like, if a high risk mama is laboring, are you going to send her home to labor? What does that look like? What does your care for a high-risk black mother look like? So these are all the hard questions, and you should see them when we in these room asking these questions. It'll be 7 people, and they like, oh, here you go. You can answer that. Why y'all can't answer that? You know? So holding people accountable in real time is what we do on the Black Mamas Birthing Tour. And honestly, we're trying our best to make sure that we still provide as much capacity as we can. We can see a high rise of mamas and doulas and birth workers who do want to come on a birthing tour. So hopefully that is something that we can see a lot of healthcare systems funding in the future, because we can see that that is a need. Like, we've had so many testimonies of mamas say, this birthing tour has changed my whole birthing experience. Like, this has relieved so much anxiety. Like, even if I can't go back to the hospital and ask, I know I can come to you guys and you guys can have somebody advocating for me. I know there's a doula I can come talk to, a midwife I can come talk to, and if not, I know there's somebody else I can come talk to. So that's all what it's for. And I know for each birthing tour, we at least walk away with 2 to 3 mamas who didn't have a doula or a midwife. They walk away with a doula or a midwife after the birthing tour. So it's also creating warm handoffs between community members and healthcare providers. We've also had OBGYNs attend the birthing tour as well. So it's educational and cultural competent care that these hospital administrations do not provide. They do not provide the cultural competent care. We're asking the hard questions, things that we experience in real time. Okay, I'm sorry, y'all get passionate. Real passionate. We do have our third event, which is Rooted in the Womb, and that's essentially a event that we're trying to redirect our audience to womb wellness and what womb wellness looks like, how we exercise our womb, how we heal our womb, postpartum, during pregnancy, even for women who are experiencing menopause, fibroids, things of that nature. Our womb, a lot of the illnesses that Black women experiences do start within our womb, and we want to make sure that our moms know how to take care of their womb prenatal and postpartum. And that event will be hosted on April 16th, and our Black Mamas Birthing Tour will be hosted on April 13th. So all of this is during Black Maternal Health Week. We're doing a lot of work. And we are a statewide organization. We will have the 4th annual San Joaquin County Black Maternal Health Symposium. And that's April 16th in Stockton from 10 a.m. to 4 p.m. If you have any questions, please feel free to ask. Don't be shy. It is more of these flyers downstairs as well that you could take home with you. And you could just scan the QR code if you want to register in advance to get more details.
Thanks, Skylin.
Thank you so much. All right, so we have time for just about 2 questions. I'm gonna come back. Yes. Whose hand was up? Excuse me. Now we only working with one mic, so you're gonna have to give me a second. Go ahead, baby.
Hi, how are you? Thanks so much for this. I got so much from it. I had a quick comment and a question. The comment was just when you were reading the Big Beautiful Bill, like those statistics, I was just so struck by like the same people who are passing this legislation are the same people who keep talking so much about declining birth rates and how people aren't having enough children and how there's nobody creating families anymore. And it's such a like fascist, right? Eugenics logic, because it's like we want people to have kids. We just want the people who are middle to upper middle class and above, who are disproportionately white, disproportionately educated. Those are the people who can afford to have kids in these particular ways, but not all these people who would need access to public assistance and the sort of, socialized medicine that would allow, all the things you're saying around nutrition and that sort of thing. And closing maternity wards, that's just awful. I didn't know about that piece of it. The question, though, is you were mentioning the other bill in California that was allowing more access to doulas. And I was just curious, is there enough doulas? Are people actually able to get them, even if they have access now? And like, how are people even getting into that like line of work? I was just curious about the number of them. But thanks again for this.
Thank you. That's a great question. And so I'll preface that by saying a piece of legislation getting signed into law isn't the true win that you think it is. Just in terms of once a bill is passed into law, you now have to consider the implementation of that bill. And so when we think about the doula Medi-Cal benefit, we are seeing, unfortunately, that there are not enough doulas that are Medi-Cal certified. And so I think administratively, it has been difficult for doulas who are seeking to get that accreditation or that certification, Medi-Cal certification. It is a process that can be quite difficult if you are unfamiliar with the process. Shout out to Frontline Doulas and the LA County Medi-Cal Doula Hub. They actively guide and support doulas through becoming Medi-Cal certified. But let's say you're not a doula in LA, right? And you're in a rural county, and right, and so from what I understand, we are definitely seeing this imbalance of one, there are not enough doulas to serve such a densely populated county like LA County, and then the doulas that we do have, there is a good amount that do not have that Medi-Cal certification. So we're seeing the gaps, but mentioning the Medi-Cal Doula Hub, there is work that is actively being done to support doulas and ensure that we can get as many doulas as possible to be certified so that folks who are wanting to have that free doula benefit can have that. Thank you.
All right, if they have to be real quick, yeah.
Well, it's so great to see you, Hayes, here. This woman is an amazing. She's just a healer all around. She's a midwife in a traditional sense, and she's an amazing doula. And when I first moved to LA over 20 years ago, everyone was talking about her then, and it feels I'm just honored to have her as a sister friend. We've been to births together and all the things. Well, yeah, and vice versa. Yeah. And likewise, and I just wanted to say I am a midwife. I'm a black midwife here in LA. I co-own Kindred Space LA. We also have Kindred Space Antelope Valley. Happy to see our name in the Birth Joy Guide, and everything. Thank you so much, Gabrielle, for giving us the lowdown. I'm here to support. I got to listen to Gabrielle and other wonderful people speak at the California Black Birth Equity Committee. And by the way, that's an amazing organization. You did mention them that are really looking at things like from the bird's eye view in terms of black maternal health, and absolutely follow them. So California Black Birth Equity Coalition. There are, from the outside looking in, California's got it going on when you look at the rest of the country. But those of us who are here in the trenches of California know that we have a lot of issues and a lot of problems. And to your question about doulas, are there enough? There's never going to be enough. But wow, we have something here that's really unique and that has been fought for very, very, very hard in a grassroots effort to bring the doula benefit to LA County, actually California. And so there are still problems, but we really have something that is being solidly built by folks just like us here in this room that are doing all the grassroots work. So if you want to put support behind these efforts, like I said, these organizations are leading the way. I do want to say too that thank you for talking about the birthing tour because I forgot that it was Black Women for Wellness that did it, but they've been to our center on their tours, and we have clients. Uh, we have people that have come and signed up for care with us. Just want to say that, like as a statement and an overview, that it's so much more complicated even than it even sounds. It already sounds complicated, but and I think especially because we're trying to make change at the systems, at the institutional level, and we're trying to change these systems, but it's actually all the movement is happening in the grassroots. So the grassroots is pushing the systemic changes, and that is beautiful, right? And it just means that we all of us have a lot of work to do in bringing awareness to what the issues are. We're trying to fight for midwifery reimbursement. Our birth center does not accept insurance, and we don't accept insurance because even we can get reimbursed, but the reimbursement rates for us are so abysmally low that we will go out of business. We will close our doors. So we work with family foundations. We work in relationships to bring funding to our center so that people can, and partnerships with people like Black Maternal Health Center for Excellence, another wonderful organization, so that we can take care of people and actually pay ourselves, pay our midwives, pay our facility, and the beauty of, like, we need a public health system that works for everyone, but I think the beauty of us being outside of that system is that we're not constrained by it. And so I do not believe in lack. You spoke about the basketball stuff that's going on, the millions and millions and millions and billions and trillions of dollars that are out here, and we're fighting for dimes and nickels. And I think that we all should work together to think outside the box and not just totally depend on these systems that aren't about us in the first place. You got a friend, I got a friend, this one got a friend, it's got a little bit of money, invest in it. We do it at a better cost anyway when we're not engaging these systems, and it isn't the complete answer. We should have strong systems, but we're not going to let none of this stop us. When the grand midwives, and more recently we've wanted to call them grand midwives because granny midwives was actually a derogatory term for these women. So we're going to call them grand midwives. They were being paid by somebody your family gave you some eggs. So your family gave you some chickens. If it wasn't for that, we wouldn't be here. So how can we turn this around? How can we just grab a hold of this and stop waiting for these systems to change? Because babies are getting born every day, and it's not going to happen overnight. So we got to kind of fight with the systems, and we also have to think outside the box and figure out how can we provide care for these families that truly need us. So it's going to continue to be a collective effort, and it's just so nice to see people here that are interested in this subject on a rainy LA night.
Mic drop. That's it. Thank you.
Thank you so much, Gabrielle, for being here, Skyland, and for all of you all for being here. Unfortunately, we don't have any more time for questions, but we truly appreciate you for showing up for yourselves and for the community. There are some pamphlets and other information downstairs on the table that you can get some information about Black Women for Wellness, and we'll be around for only a few more minutes. If you want to speak to Gabrielle, please feel free to do so, but thank you so much for being here, and have a safe travels back home. Good night.